Good evening, everyone, and thank you for joining us as we kick off a Fireside chat series bringing important information to people of North Carolina about the state's COVID-19 vaccines rollout. Tonight, we're honored to have with us Dr. Mandy Cohen. Dr. Cohen is Secretary of the North Carolina Department of Health and Human Services. And we're especially honored to have the Reverend Dr. William J. Barber II as our featured guest. Reverend Barber is a nationally renowned figure on many fronts. He presides as the senior pastor of Greenleaf Christian Church in Goldsboro. He is a political, civil rights, and social justice advocate. Reverend Barber serves as the president and senior lecturer at Repairers of the Breach and co-chair of the Poor People's Campaign, a national call for moral revival. The Department of Health and Human Services has embarked on these live stream chats as one of the many ways in which we are working tirelessly to prevent the spread of COVID-19 and ensure equitable access to timely information, resources, and COVID-19 vaccines, regardless of a person's insurance coverage or legal status. We know that this virus has hit communities of color especially hard, and so we're doing everything possible to ensure the equitable access of information about the vaccines, resources to help people make their appointments, and ultimately to ensure everyone who wants a vaccine has a spot to take their shot. The department has made many adjustments to its vaccination rollout plan to ensure we serve everyone, and especially our historically marginalized communities, equitably, with transparency, and as quickly as we can. So let's get started. I'd like to invite Secretary Cohen and Reverend Barber to start us off with a few remarks. Secretary?
Well, good evening, everyone. Thank you, Deputy Secretary Ben Money. Hello, this is Mandy Cohen. I'm the Secretary of the North Carolina Department of Health and Human Services, and it's wonderful to be with you. And it's such an honor to be here with Bishop Barber for this important conversation. So thank you so much, Bishop, for giving us your time. You know, any conversation about health and about vaccines has to recognize and acknowledge some certain truths. And those truths are the fact that we have structures that have historic inequities, that structural racism exists and then plays out in our health systems, our economic systems. And that means that for COVID, it has also played out in a disproportionate way. Now, we know that in our department, we have attempted our response to COVID-19 to make sure that we are counteracting those historic structural inequities, and vaccine administration is no different as we do our work here. It is an enormous undertaking. It takes a lot of partnership, and I'm so grateful for all of the partners across North Carolina that are working hard to make sure that we have an equitable response to this COVID pandemic, and we work hard to get vaccines out equitably to all. I look forward to sharing more information about how we're doing that, and I really look forward to this conversation over the next hour. Thank you again for giving your time, and Bishop Barber, it's such an honor. Thank you.
Thank you, Secretary Cohen. Reverend Barber?
Thank you so much, Secretary Cohen, and thank you, my brother, for leading us as well, emceeing us here today. It is such a privilege to be able to help in the effort to ensure that people get the relief that's needed, the treatment, the vaccines that are needed for COVID relief. When I first received a call from my dear friend, Reverend Dr. Michelle Laws, the answer was immediately yes. I've been watching, Secretary Cohen, your work and how clear you have been for the people of North Carolina. You are indeed a gift. We know, and I know from just the scriptural standpoint, that truth is the only thing that can ultimately set us free. We cannot deal in distortions and lies. We need to deal in direct truth. And you and the governor and others have attempted to be very forthright from the very beginning. This pandemic has exposed the fissures of systemic racism and economic disparities. But there's a good thing about exposure, even in the negative, and the fact that exposed means you can see it. And if you choose to see it and look at it and analyze it, then you can fix it. You can deal with it. And that's what we have to do, because we are indeed in this all together. We must be our brother and sister's keeper. We must be concerned about our neighbor. There's no way out of this but together. Right now, we is the most important word in fighting COVID. It's the most important word in the justice vocabulary. We the people, we have to do this together. And any disparities do not help us, whether it's the disparities that come with being poor in Appalachia in North Carolina, or whether disparities that come with having lack of access because you're brown or undocumented, or you're African American, or you're indigenous. We must be one people. We must close these disparities and not dismiss them. I was thinking the other day about how we've had, experiences in the past. In the first pandemic 100 years ago, we didn't get the truth, and we did not come together, and 650,000 people died in between 1918 and 1920. We can do better than that now. We can do better with new leadership, new commitment, and a new way of seeing the world, all of us together. We have a saying in the movement, everybody in, nobody out. Everybody in, nobody out. And surely if we lift from the bottom, then everybody is lifted. And so I'm glad to be a part of this first Fireside Chat as we lift up everybody in, nobody out. Get the truth, get the facts, get vaccinated, wear the mask. You saw me when I came on intentionally, double mask. I have an immune deficiency. And so I have to be concerned about others as well as myself. But we have to, in this moment, be one community. Last step, Secretary Cohen, our Constitution in North Carolina, when it was rewritten in 1868, it says we hold these truths to be self-evident, that all persons are endowed with certain inalienable rights, among which are life, liberty, the enjoyment of the fruit of their own labor, and the pursuit of happiness. In Article 11, Section 4 said, beneficent provision to the poor, the unfortunate, and the orphan is the first duty of a civilized and Christian state. Let us be civilized in what we do and make sure that we do the first duty, lifting up those who've often been left out. And if we do that, everybody rises, everybody in, nobody out.
Both. And now I'd like to turn tonight's Fireside Chat over to Ms. Phyllis Coley. We're delighted to have her with us tonight to serve as our moderator. Ms. Coley is the CEO and publisher of Spectacular Magazine, an ambassador in our outreach and engagement efforts. Thank you, Ms. Coley.
Thank you, Deputy Secretary Money, and good evening. And I am so glad that I could be here with you tonight. Secretary Cohen and Dr. Barber, this is such an important conversation. It's important that people understand how to protect themselves against the COVID-19. Right now, we have had more than 760,000 cases across North Carolina of COVID. And right now, today, there's about 2,700 people in hospitals across our state. We have to talk about how to protect ourselves and each other from COVID. And that's what we're going to talk about tonight. Dr. Barber, I wanted to start with you. And you talked about how and we in the Black community are mistrusting of science. And I know 100 years ago, I know with the Tuskegee experiment and those kind of things happened. Do you think that we as a community should still be distrusting of science today?
Well, I think that we should get all of the answers, and that's what's important to people, and what Secretary Cohen is doing. It's not so much mistrust, it's getting the answers and getting the truth out to everybody. We've been through a great season of lies and distrust in the last few years, if we just speak honestly. So a lot of people have distrust. But I think something else is going on right now. There's a study that came out recently that actually said white people have more distrust about the vaccines than African Americans. And we have to be careful not to make that the reason that we are seeing the disparities, particularly in the African American community, or in the indigenous community, or in the Latino community, because I want to talk about people of color, or even in the poor white community. The other question we must ask is, can we trust the systems of delivery? Can we trust that enough money is being put to make sure that there are places for all people in all communities? Can we trust that there is in every decision that is made, there is a lens that says, now, how will this impact Black people? How will this impact brown people? How will this impact poor people? How will this impact indigenous people? Can we trust that there are people at the table who are ensuring that communities do not get left out? Are we using all of the facilities that we have in communities, community centers, pharmacies that are in communities, churches? What are we doing? Are we strategically placing? And so we have an interesting moment right now. Some of what we see in the disparities may be because of historic mistrust, but the larger question we must ask, since now there is polling data that says even the majority, more white people actually distrust what's going on with this particular vaccine, is what systems are we building to create the trust that the access is there, the access, the information, and all of the personnel. I almost asked you, Phyllis, when I saw the Secretary of Money, one of the first questions I was going to say, but I said, his name is Money. Well, maybe we can get all the money we need from him. But the larger question for me is, do we have enough money? Are we putting enough money in the delivery systems? Do we have enough vaccine? Those are the bigger questions that I think people are asking now when it comes to trust. Is there an all-out effort to make sure that no community has less access, less information, and less personnel to deliver the vaccines as they need to be?
Thank you. And then, so Secretary Cohen, I would then like to go back and let's make sure people understand what Dr. Barber is referring to. The data in the North Carolina about the delivery of the North Carolina vaccine shows that the vaccine has overwhelmingly gone to white North Carolinians. And so can you discuss that? And before we talk about access, let's just try to bring people up to where we are and what's on your dashboard.
Well, Phyllis, first, thanks for joining us tonight. And I'm really glad you started with the topic of trust, because I think it's foundational. And I think having conversations like this are ways in which I hope that we can earn everyone's trust, because I think it's through this dialogue and making sure folks know where to get trusted information and get their questions answered is how we can build trust in potentially systems that haven't always earned it in the past. But that's my commitment to all of you tonight, is that I'm hoping to earn your trust as we go forward here. And so let me talk about what we are thinking of and how we are approaching our work. And this started before vaccine, and really in the work we have done for the whole COVID response, as I was saying earlier, is to really put equity and access at the center of what we were doing. It started with testing, for example, something we had to build from the ground up. And as we did it, we knew we had to put resources, time, money, talent, people to make sure that we were getting testing access. And what I'm very proud to say is that we've worked very hard and have closed those disparity gaps as we've gone forward. And so I think it's in that partnership that we bring to our vaccine work as well. But the reality is, you can look at our data right now on our dashboard, is that we do not see that we are vaccinating our African American community, our Hispanic community, our Native American community at the same rate that we are vaccinating our white community. And that means we have work to do. We know there's a number of reasons we may be here at this moment. Some of them is that as we went into the vaccine effort, we had talked to folks and done research, and we knew there was more hesitancy in the African American community in particular. And that is understood, right? We've been talking about the structural inequities built into a system and that mistrust. So we had our work cut out for us, but we know that the system itself has underlying issues. And so it's our job to sort of counteract that with the policies and the programs, and to Reverend Barber's point, the money and the resources to make that possible. So there's a lot of things I know we're going to get into that we are doing through how we are allocating the vaccine, making sure it's getting into all of our communities, that we are partnering with folks like our faith community and having events at churches and our historically Black colleges and universities, to making sure we're setting aside additional vaccine for those who are serving more of our African American community or Hispanic community, bringing on providers who are well known and trusted, like our federally qualified health centers. So there's a myriad of ways in which we're trying to get at this, but it starts with trust and making sure folks know where to get good information and get their questions answered.
And I think right now, then, while you're talking about a place to get that, now would be a good time to talk about where would that be? Would that be your website?
Great. Thank you so yes, one of the best ways you can get information is you go to yourspot.nc.gov. So yourspot.nc.gov, and we're always putting new information, but that is where you can get your questions answered. I would also say we've also stood up a hotline for folks to call. So if you're not interested in going to yourspot.nc.gov, you can also call our call center, and they are there to answer your questions about vaccine. Where can you get a vaccine in your community? So there are a number of ways in which you can get good information.
Okay, so I'm going to go to this next question is for you, Dr. Barber, and it's really staying on the same subject. But what are your thoughts on how the state could distribute the vaccine more equitably?
Yeah, and I'm glad you came back to that, because I do want to push on this a little bit. Yes, there has been some historical mistrust, but I think we have to be careful with that, saying that's the reason there is disparities first and foremost. Because as I said, there's polling data that shows that white people are more distrustful of the vaccine. So what we have to first and foremost do is look at the systems and look at the access. That has to be first and foremost, because we knew the disparities would exist because they already existed prior to COVID. So it's not as though the disparities were shocking. And one of the sad things that COVID has exposed is that things we should have dealt with, we had not dealt with. I mean, remember, we're in a state where our legislature has refused to even allow the expansion of healthcare in a state that has almost 1 million people without healthcare going into COVID. We're in a state where we have 49% of the people are poor and low wealth, and over 2 million people make less than a living wage. So one of the things I think we have to do also with this, is Secretary Cohen and others, is we need to disaggregate what's happening to the delivery among poor and low wealth people. Now, my daughter is a PhD in public health, graduated from Harvard, works at Drexel. And one of the things she has shared with me is that data is not being readily kept. We're looking at racial disparities, but there is a disparity even within the racial disparity, and that is the delivery to poor and low wealth communities, whether they be white, Black, brown, or indigenous. So one of the first things we have to do is assess how is our system really reaching poor and low wealth communities, Black, white, brown, so forth and so on. Secondly, we may say we use the internet, but we have a disparity built into the system prior to COVID with access to internet, access to broadband. So how do we get around that? The question becomes, how do we use radio, AM and FM, Black radio, to get information out? How do we target, and with pastors like myself and many others, who every Sunday morning are on live stream with thousands of people? I have as high as 20,000 people sometimes on live stream. Are we partnering and using that? How do we use, since many times in rural communities and in poor communities, the health centers are not in those communities. The health centers are many times way away, where people don't have access to public transportation. So how do we put mobile units into the communities, mobile public health units into the communities? How do we use community centers? How can we utilize church sanctuaries that are not being utilized right now anyway, where people have a great trust in those sanctuaries? How can we make sure that persons that people trust, i.e. their doctors? One of the things that we know is that many people, doctors, like my own personal physician who serves down in Clinton, North Carolina, and Fayetteville, Dr. Rodney Sessa, has a broad reach. How have we talked to and reached out to those doctors who work among people in poor Eastern North Carolina, in rural Appalachia, in communities where we have large numbers of farm workers, large numbers of Latinos? I think that what we have to do is think about that disaggregation. And are we putting the resources and the personnel in those places? Remember, we have a lot of people who are without transportation. We're a state that, as I said, 2 million of our workers don't even make a living wage. And there's not a county in this country anywhere where making a minimum wage, you can even afford a 2-bedroom apartment. So I think that we need to go underneath even the numbers. We've done some analysis on race. We need to do some analysis on race and poverty. And I think what you would find in that sometimes people at a quote a higher economic level, they're getting the access, they're getting on the internet, and so forth. But the disparities come when you combine the racial disparity and the economic disparity. And we often haven't done that. And that is, and we have to be careful of constantly suggesting mistrust from Tuskegee, because that lets people off the hook. It tends to suggest that people are still stuck in it, and that's actually not the case. A lot of the disparities come from people do not have the access in their communities, and we have to look at that access, particularly through the lens of race and economics at the same time. And in that way, you could actually build bridges between poor folk in Appalachia and Black folk in Eastern North Carolina and Latino folk and Indigenous folk. But we have to bring that and then look at what are the structures, what are the existing structures in those poor and low wealth communities that could be places of access, and who are the people in those areas that could help make that access real and build out more and give out more information so that people know what is in fact going on.
I'm going to come back to you, and let's address some of those things that Dr. Barber just brought up. People in rural areas who don't have transportation, internet service, being able to get online and make an appointment. And he talked about trusting your doctor. And let's talk about how do we deal with people who don't have a primary care physician. You know, there's a lot of people in our community that use the emergency room as their primary care physician. So, Secretary Cohen, please let's talk about what the state is doing to address those inequities. Secretary Cohen.
So many important points. Can you hear me?
Yes.
Great. There were so many important points there about the intersection of wealth and access. So first, I want to pick up on your point around Medicaid expansion. And I know we're talking about vaccines here, but you are so right in that our state went into this crisis weaker than we needed to be. Medicaid expansion is something we should have done years ago, and I think is still incredibly important for our state to do in order to get access for more folks to our healthcare system. So just wanted to say that the governor and I continue to advocate for that. And I hope to see movement in the General Assembly. There's one word that we need to hear, and it's yes. There's no state dollars needed, just the word yes. So I want to see that happen for our state and happen quickly. But there were a number of issues that you were talking about around access and how that comes together with geographic access, wealth access, and others. So a couple of things that we are doing, and then look forward to feedback on how we can even do more. First, in how we are even just thinking of distributing the vaccine across the state, we are taking into account wealth indicators as we do that allocation. We're actually giving additional vaccine allocation to places in our state that serve a higher proportion of those who are over 65 and low income. And so we are trying to make that intersection here. We are also doing an increase in vaccine allocations for those who are over 65 and from African American, Hispanic, Native American communities. So we're trying to do that just in how we distribute the vaccine. But to your point, then we have to get the access points that folks trust close to them. So there's a couple things, whether we're encouraging partnerships, like you said, at churches where folks are already known and know that they can go there and know that location, can get good information. I think those partnerships have been really important. We want to make the vaccine more mobile, but remember, supplies are incredibly limited on vaccine right now. So I know it's frustrating to say, why isn't it here in my community? That is, we know, is happening across the state and frankly across the nation because supplies are so limited. But do know that we're trying to work as fast as we can to get more supply from the federal government, get those vaccines out. And as far as transportation, huge issue. We actually released $2.5 million in transportation grants to our local communities so folks can get rides to and from their vaccine appointments, recognizing we can put an access point close, but in our rural areas, we know that's still really hard for folks. So you have to have the transportation piece as well. So we know there's a lot of work to do. And I want to acknowledge that we have also built up some infrastructure of community health workers, folks who know their communities well and can help be the glue for some folks who really need to help them access, whether it's vaccines or primary care or other kinds of help that might exist in their communities.
And Phyllis, can I make a point that's on my mind?
Yes, please.
As a
Go
conversation.
ahead.
And I think it's important, Secretary Cohen, that people remember from the day COVID hit, the federal government, the former administration, put this nation in a terrible mess. So we have to be careful that we don't drop all the blame on you and people don't get discouraged because number one study in Columbia said 60% of these deaths should have never happened. Number two, we should have had a full response. Number three, we gave $4 to $5 trillion to corporations and we still haven't given money to states and cities and counties from the government. Number four, a lot of the people that gave money to corporations advocated, even at the federal level, they would say back to the states, especially in the South, let's talk about the South, there's not a Southern state that has expanded healthcare. That's absolutely foolish. There's not a Southern state senator that has voted to send more money to the states. We have to we have been put in a mess that we haven't seen since Woodrow Wilson denied the pandemic and caused all the deaths that it caused back in the early 1900s. And we still now have, just the other day, people trying to roll back a $1.9 trillion plan, which in itself to us in the Poor People's Campaign is a compromise already, because really what we need is $2 or $3 trillion. Now, having said that, since we are going now with a new administration and we've had a governor and you have tried to do the right thing despite some of the legislative things, what I want to suggest is while we're waiting on the doses to come, they should have been there. There should have been no way that we get this vaccine and didn't have a rollout plan. But you didn't do that. That was because of the federal. But while we're waiting, some of the things I think we should be doing is right now, we should have some great statisticians and people say at North Carolina Central, that's a good school over there, like North Carolina Central.
I agree. I agree.
I'm just messing. And maybe do an analysis right now based on poverty. What's the level? Who's getting vaccinated, right? Do poverty and race, not just race. Do poverty and race. Poverty on who died and who's dying, who's getting infected, who's getting vaccinated, so that when we do get the doses, or as you're building the system, you work into the planning for the system, the plan to deal with the disparities we already know exist. And then the other thing is, I give you examples. This is the way, when I took public policy, we tended to do. We look back from the people who ought to be able. So for instance, I have a nurse in my church who's actually headed back to work today. And the place she's going to work has known she's coming to work and haven't been able to get that person a vaccine for months, for days, for weeks. I mean, you think about that. This person is going back on the front line and haven't been able to get, or my mother, for instance, and who's one of the most known senior citizens in Eastern North Carolina. She's been calling for 2 weeks. Now, I'm not advocating for my mama on this show, but I'm trying to say, if my mama can't get a call back, oh Lord have mercy. If Eleanor Barber can't get a call back, and everybody knows Eleanor Barber, black, white, brown, that she was in the school system 50 years. And if she has to go to the mayor and the county commissioner and to try to get a call back, and she still can't get a call back in Eastern North Carolina, then how is Sister Sally, who's in the Second Baptist Church, how is Mother Green in the African American Episcopal Zion Church, or how is Sister Beulah, who's an elder white woman, but doesn't have access? How are they going to? So I think sometimes we have to look back from who's getting the access, and then ask them, did you have any struggle? And if they had struggle, then we know. And while we're waiting on the more dosage and build that into the system.
Thank you. We have been, this is a live conversation, and we want to encourage our audience to please put questions in the comment line. We're going to go now to some of our audience members who ask a question. And this question is for you, Secretary Cohen. The question is, what about the essential workers?
Yeah.
Your essential workers are expected to still show up for work, but they are not create as essential when it comes to getting the vaccine. They're not looked at.
Well, thanks for that question. So obviously, with the very, very limited supply of vaccine, we did need to make the vaccine available in phases. Right now, we are vaccinating all healthcare workers and all people who are 65 years and up. And what I can say, I know the demand is high all over the place. And I know it has been frustrating that there aren't enough appointments for the vaccine to go around. We know our vaccine providers could be giving out 3 times as many vaccines if they only had the supply. So that continues to be a problem. But for our frontline essential workers, you're next. So when we have a few more weeks of getting to those who are 65 and up, there are a lot of them in that category. Remember, those are the folks who are 65 and up represent more than 80% of those who have died from COVID. So we know age really makes a huge impact in your risk for COVID. That's why we started with those who are over 65. But I hear you, frontline essential workers. Those are our teachers, our child care workers, our police officers, our firefighters. You are our frontline essential workers. We know you can't stay home to do your jobs. You've been heroes throughout this pandemic. So frontline essential workers are our next group up. After that, we want to get to those who also have chronic conditions that put them at higher risk for COVID, and get to a few additional essential workers. And then I hope by then that we are going to have more vaccine supply and then can start to get to the rest of North Carolinians, because I want everyone to get their shot. And so we're going to work hard with the federal government to make sure we have the vaccine supply that we need to get to everybody.
And Phyllis, can I take a shot at that question?
Sure.
Comment?
Go ahead about the essential workers. Yes.
Yeah, because I'll say to Secretary Cohen that when the Poor People's Campaign, a national call for a moral revival, looked at the national rollout, and when they first started saying that they would do senior citizens first, we actually challenged that position. Now, I just mentioned, Mom, so I'm not challenging senior citizens. I pastor senior citizens in my church, but we also knew, and this is something people don't think about, because of the disparity in life expectancy, we knew that if you targeted seniors alone, primarily at the beginning, even though they were 80% of the deaths, we also knew that there would be a disparity in terms of race and a disparity in terms of poverty, because we already knew going into COVID that 700 people die a day from poverty, 250,000 people a year. So life expectancy among the poor and life expectancy among people of color and indigenous people and Latino people mean that there are less of them that will reach those senior years. What we had argued for was both the senior citizens and essential workers, the senior citizens and essential workers, which would be a way of dealing with that gap, and would also be a way to make sure that the essential workers not only would be treated as essential, but they could continue their essential work in a safe way that would actually save the lives of more people who are predisposed to death, like seniors and others who have pre-existing conditions. So one of the things that we think has to really, really happen now in this moment, and again, so much failure at the federal level, but that hopefully that changes. If you're concerned about essential workers, you need to be demanding, and maybe Secretary Cohen can't say that, I can say it. You need to be on the phone every day to your congressperson and senator. You need to be wearing their phones out and saying, what is wrong with y'all? They should have passed the COVID relief plan on January 22nd. It should be done right now. There's no reason to be holding that up. And the reason is because the plan is $1.9 trillion. Businesses and corporations got 84% of the first COVID relief bill. 84%. 84%. Banks and corporations on one occasion last year immediately got over $1 trillion, and it didn't even go through the Congress. So when you block COVID relief, you're hurting essential workers. It means that you're calling people essential, but you're not treating them like essential. If we're essential, protect us, respect us, pay us, and vaccinate us. That ought to be. And then lastly, as you are planning for the dosage to come in, Secretary Cohen and your team, I would encourage that you have these questions right at the table. And it would go something like this, that as you're planning, you say to your team, this is what we have to do as these doses come in and we get the money. We must ensure that those who were the first to stay at work, the first to take risk, the first to get infected, the first to get sick, and the first to die can't be the last to get treated. That's the series of proclamations we must make on whatever plan we're building for going forward and whatever delivery. From here forward, this is what we must make sure, that the first to have to stay at work, the first that had to take the risk, the first that got affected, the first that got sick, and the first that died are not the last to get taken care of. And that in itself will address a lot of the racial and the economic, because take, for instance, just among women, 7% of tip workers are women. They were some of the first ones, to get affected. And they don't have health care because they make $2 and change and they depend on tips. Tips have gone down. And in addition to that, 60% of them couldn't get unemployment because they didn't have enough base money. So if we say, listen, from here on, this is what we're going to build. We're going to make sure now, from here forward, we can't do anything about the Trump and all, but from here forward, we're going to make sure that the first that had to stay at work, the first that had to take the risk, the first that got affected, the first that got sick, and the first that died are not going to be the last to get treated.
Thank you. Thank you, Dr. Barber. And when you talk about, lobbying your legislator, your elected official, your congressman, and your senator, I'd like to insert right here that there's an easy way to do that. If you download the 5Call app, I'm not endorsing them, but it allows you to place 5 calls at one time to that same senator or that congressman, and it comes with your senator and congressman's office numbers already in the app. And so I just want to encourage that, because I personally think that that's the only way that we're going to get what we need in this state is to lobby for it. And we have to fight for it. We have to fight for it.
Yeah, and there ought to be some emotion. We ought to lobby on behalf of all those folks that died that didn't have to die. My position, Coley, is people ought to look at it like this. Why are you still breathing? Any of us could be gone right now. Any of us could be 7 days from losing our last breath. So the question is, what am I going to do with the breath I have left, whether it's 7 minutes, 7 days, 70 years, or 7 months? And with every breath we have, we ought to be using it. Because look, this is man-made. The virus is not man-made or woman-made or human-made, but an inept response was caused by us. Now we've got new leadership. We've got some people still trying to block. I heard somebody today say, well, people are really doing great. They're not doing that bad. Folk, they need to hear from you. You need to call them with the tears in your eyes and the frustration in your voice for everybody. You know, I've had one family member in my church lost 12 family members in this country, Phyllis. In the Poor People's Campaign, we had one girl at 18 years old, lost 25 family members in a 30-mile radius in Mississippi.
Oh my goodness.
But she's taken that pain and she's now joining this movement. And every day, all day long, she's on the phone. Since she's home anyway, she's on the phone demanding that they do the right thing. And we need to say to those that are in power, if you don't have a one vote, vote for the people. Vote to get this stuff delivered. Vote for more vaccines. Vote for more COVID relief.
Thank you, Dr. Barber. I'm going to go back to some questions. We now have a question from Nicholas Green, and it relates to what you're talking about because indirectly you're talking about schools and schools opening. Nicholas Green says that he saw today that the governor is supporting sending children back to school, students back to school. So are we supporting our teachers and our school workers getting the vaccine? Where do they stand in the queue, in the line to get the vaccine? Secretary Cohen.
Sure. Why don't I take that? Yes. So what we have seen is that we have more and more evidence and data to show that viral spread in schools is very low if everyone is following the state's safety protocols. We worked very hard to make sure that we were enacting very, very strong safety protocols for our schools. And we have seen quite a number go back in person. And what the data shows is that when you're using those safety protocols, that there's very little viral spread in schools. In fact, people usually, if they get COVID, they're getting it not at school, they're getting it somewhere else, unfortunately, in their community. And we don't actually see spread from student to student. And frankly, we have had 0 cases of spread from student to an adult, either a teacher or a staff member, at any time during COVID, which is very, very reassuring. And so we want folks to be back in school. We know kids need to be in school, not just for the education components of it, but we know often that is a source of nutrition and meals for folks. We know it's about social, emotional development. There's so many mental health benefits of being in school, so many. So we wanted to encourage being in school. And as I said, our teachers are our frontline essential workers. And so we are trying to get to Reverend, to Bishop Barber, to your point of really trying to understand who are those who had to be at work and continue to need to be at work. Let's get our frontline essential workers vaccinated. They're up next. And who are the ones that are the most affected by this virus, who died and got sick the most? Those are those who are over the age of 65. So we're trying to balance all of those things as we move forward with our vaccine effort and get our kids back into school.
So while I'm with you, Secretary Cohen, I have another question, which comes from Brittany Birch, who is asking, should pregnant women get vaccinated?
Great question. And so the advice is yes, pregnant women or those who are breastfeeding can get vaccinated. I always encourage for folks to have conversations with their doctor about it, but that should not be a reason to avoid getting the vaccine. So pregnant women, breastfeeding, folks can still get the vaccine.
Okay, so I am going to now go to, this is from BB Miller, and she says, I wonder how will the community especially get to people of color? We've asked that question.
The LGBTQ community.
Yes.
Those of color. Yeah. So that great, another great question. And I think, again, this is where partnerships and really good information are important. We want everyone to have access to this vaccine. We are prioritizing getting access in all 100 counties and all communities. I know that there is not enough vaccine to go around right now, and I know that is incredibly frustrating. The supply is very low. We literally have 0 doses right now in North Carolina. Now we're getting a shipment in tomorrow, and each week we get more, but we really have limited supply. But that's where our partnership with all of you are incredibly important to make sure you're partnering with your health department, your hospital system, your faith, the faith leaders and churches and other leaders to make sure we are getting everyone access to this vaccine.
And so Dr. Barber, while we talk, did you want to address that, Dr. Barber?
Yeah, I just want to say something. I want people to really hear what Secretary Cohen is saying. Listen, it's not her fault or the government's fault we don't have the doses and have the delivery. We know where that comes from. Some of that's changing. But we in this moment, therefore, have to be intentional. You know, I pastored 30 years. And I know people want to get back in church, but I have to tell folks the church is not the building. And this is not the time. I want to encourage clergymen, don't rush folk back to church and risk in a sanctuary and risk them. We need to wear our masks. We need to not be willfully disobedient. We need to double up. We need to be protected. When I was a young boy, Phyllis, my grandmama said something to me that applies to this COVID. Mm-hmm. She says, boy, don't you live your life and swim all the way across the River Jordan and then drown in shallow water.
I like that. Okay.
You know what I'm saying? She said, don't swim all the way across the ocean and drown in a creek. It's another way it's put. So my point is to folk, listen, we got to buckle up. People have been through worse than this. We've been through worse denials than this. So as things are getting better in terms of the delivery of things, let's make sure we distance, we do everything, that we pay very close attention, that we don't step down, that we don't say, oh, it doesn't matter, Super Bowl, whatever is coming up, let's mask up. And those of us who have influence and platforms, let us tell the truth to our people. And that's one question I wanted to ask you, Secretary Cohen, because I think it's important for you to answer this as a medical doctor. I heard someone answer the other night on BT. It was really powerful the way the sister broke it down. But it's important. Let me just ask this. The virus, when you get the vaccine, they do not put the virus in your body. Am I correct?
That is correct, sir. That is absolutely right.
Talk about that, because people need to know that.
Yes.
Yeah, so let's talk about how the vaccine works. Yeah, you are absolutely right. When you get the vaccine, you are not injecting COVID into your body. You're not injecting some sort of weakened form of COVID. It is not the virus. What it does is it sends a signal to your body to start developing antibodies, meaning those are the things that help us fight off the virus. So it gives you, it helps you make those antibodies that are going to fight the virus. It actually sends a signal to your cell to make particular proteins, but it is not the virus. So it helps your body make antibodies, which are the things that help you fight off virus, so that when you actually do see COVID in the community or you're exposed to it, your body already knows what that looks like and is already ready to attack and fight it off. And so that is what the vaccine is doing for you. It's creating those antibodies for you in your body. So if you happen to come into contact with the real virus, you're ready to fight it off right away. And what we've seen is that these vaccines are 95% effective. That doesn't mean they're perfect, but that the fact that they can be 95% effective, meaning 95% of the time, if you are interacting with COVID, it's going to, your antibodies and your body is going to be able to fight that off, and you're not going to get COVID.
Secretary Cohen,
can I say one thing? I just want to, now my mother is going to get me, but I want to explain it to folk in the hood and in the country. Now, what Secretary Cohen is saying, how many of y'all remember your mama's look in church? Now, I had a mama that sat on the organ, but she had this look. And when I thought about this being mischievous, she looked at me, and my mind and my heart fought that thought off. It just said, nope, you better not try that. That's what this does. It sends a signal to your body, this is not supposed to be here, and it begins to fight it off. Just like mama's look. And some of us know that look would go with you when mama wasn't even around.
That's
You'd
right.
be somewhere about to do something, and that mama's look would come up in your mind and say, don't do that, don't do that, don't do that. So that's what this is. It's not the virus. So don't let people tell us a lie. It is not the virus. It is a vaccine that, in fact, fights all. But you have a right to ask every question. That's the last thing I want to say. Nobody should say to you, just take it. No, when you're taking it, ask the questions. Ask the questions. And please, those of you that do this, give people the answers. And that helps so much with people being more forthcoming.
We have another question for Secretary Cohen from the audience, and they want you to talk a little bit about the cost associated with the vaccine. Do people have to pay? Is it available for those that are uninsured?
Great question. This vaccine is free. So this vaccine is paid for by the federal government. For those who do have insurance, sometimes your provider will bill your insurance for administering that, but there should be no cost to you as an individual for this vaccine, which is great news. And again, one of the things that helps improve access. So we don't want cost to be a barrier at all. And so there should be no cost for you for this vaccine.
All right. Now, Dr. Barber, I want to come back to you because I really want you to talk to our community leaders and talk to our faith leaders about what they should be doing in the community right now.
Okay. Well, what I think we should be doing, first of all, using every available platform that we have to get this message out. So many of us pastors, we're on the radio. Many of you are on TV. Many of you are on social media. And we need some real clear fact sheets designed for that, Secretary Cohen and others. And we should commit the rest of this month to getting this information out. We need to dramatize it in the public. Those of you that are distorting the truth to our people, stop it. I mean, even if in my community you supported Trump, okay, this is not about that now. This is about people living. This is about people not dying. This is about people being able to see their grandchildren and live a good life. And so let's stop all of the other stuff and let's tell the truth. And secondly, Secretary Cohen, and I know Dr. Spearman with the NAACP and others, I would love to see us find a way, Dr. Laws, Phyllis, you, to gather all of these various church bodies and say, listen, we protected, many of us did sanctuaries for our Latino brothers and sisters to protect them from the ruthless and racist roundups that were done in the last administration. I believe we ought to now turn our sanctuaries into vaccinating sanctuaries. And Secretary Cohen, I want to commit here, and I believe others will. If you, the governor and others, Phyllis, Michelle and others, call us in. And as you are planning for these more doses, we need to already be set up so you know that such and such 5 churches in Goldsboro are going to be sites, 10 in Asheville, 17 in Fayetteville, so forth and so on. I think we ought to do that. And then all of our brothers and sisters in media need to follow the lead of Sister Coley. All our stations everywhere. We need we need to have our music on Sunday morning and our party music. I listen to it all, our jazz, but we've also got to put with those rhythms, the truth and the information about COVID-19, the vaccines, and why we need to get everybody vaccinated. The last point I want to make, we all know, or we're beginning to learn, and maybe Secretary Cohen will speak to this as well, that the more people we vaccinate, the less mutations we have, the less variants we have. And that is so important for the long-time full recovery of this pandemic. And am I right about that, Secretary Cohen?
Dr. Barber, I want to thank you so much for that wrap up. I'm going to go to Secretary Cohen, just like you said, and we are going to let her wrap up. Tell us what we need to be doing. Even if we've gotten a shot, do we still need to be wearing our mask? And so if you would please wrap that, give us your thoughts and wrap that up for us today.
Sure. First, I just want to thank everyone for joining us this evening. I hope you learn more about the vaccine and our efforts. I want to thank Bishop Barber and thank you, Phyllis, for moderating this great conversation. You heard a lot of information. Anything you missed about vaccine, you can get at yourshot.nc.gov. On there, not only can you find out about how the vaccine works, that it's not injecting COVID-19, but to Dr. Reverend Barber, to your question, that yes, if we vaccinate and we vaccinate well and quickly, that it does improve our ability to cut down on variants. So it's important across the board. But I think it is also, we need to remember that this is a marathon. We don't have the supply of vaccines right now, but we have a lot of virus here in North Carolina. So we have to go protect each other and remember that we need to be wearing masks all the time when you are with someone who you do not live with. It's incredibly important. Masks work. They're easy to do. And so we need to make sure that we keep up our 3 W's, the wearing of a face mask, waiting 6 feet apart, washing your hands often. You want to get good information, yourshot.nc.gov, and we need to expand Medicaid and do a whole lot more to make sure that we are partnering to get this vaccine out quickly and equitably as we move forward. So thank you so much again. For everyone for joining, and particularly Bishop Barber, it is an honor to have spent this hour with you.
Thank you so much, Secretary Cohen. And then I want Dr. Barber, thank you for taking the time to do this. I really appreciate it. Thank you both. Listen, I've enjoyed being with you tonight. Thank you guys so much for watching. And right now, I'm going to toss it back to Deputy Secretary Mandy.
Thank you so much, Ms. Coley. We invite you to follow the North Carolina Department of Health and Human Services on Facebook, Twitter, and Instagram for the latest information and details on our next Fireside Chat. We plan to have these types of conversations from across the state. We'll be talking with leaders from the Hispanic and Latinx communities, American Indian tribal leaders, representatives from the state's agricultural industries, business leaders, health experts, and others. Until then, please visit yourshot.nc.gov. Thank you so much for this evening. Be sure to wear your face coverings, wait 6 feet apart, and wash your hands. Good night, everyone.